Excuse me. Again, my name is Autumn Valerio. I'm a program coordinator with the California Institute for Mental Health. Also in the room today we have...
Hi there. My name is Christy Hagens. I'm also a senior associate and a staff here at the California Institute for Mental Health. Welcome.
And we are also very fortunate to be joined today by Dr. Rita Cameron-Wedding. Dr. Cameron-Wedding is the chair of the Department of Women's Studies and a professor of Women's Studies and Ethnic Studies at Sacramento State University. Dr. Cameron-Wedding's scholarship focuses on race, gender, and social class disparities in institutions like child welfare, education, and juvenile justice. Dr. Cameron-Wedding has taught courses and developed curricula addressing implicit racial bias for over 6 years. She wrote the curriculum Addressing Racial Disproportionality in Child Welfare, One Social Worker, One Solution at a Time. Excerpts of this work are incorporated into the Cultural Competency Curriculum of CalSWEC, the California Social Work Education Curriculum. Dr. Cameron-Wedding provided the keynote address and facilitated a two-day conference for the Family Court of the Superior Court of the District of Columbia, presented to the Children's Bureau in Washington, D.C., and provided expert testimony to the Florida Blueprint Commission on Juvenile Justice in Orlando, Florida. In 2009, she addressed the Federal Advisory Committee on Juvenile Justice, the National Conference of the Office of Juvenile Justice and Delinquency Prevention, and the Third National Judicial Leadership Summit on the Protection of Children. Dr. Cameron-Wedding has conducted trainings throughout the United States. In California, she has provided countywide trainings for children's services agencies in San Francisco, Contra Costa, San Joaquin, Santa Clara, and Ventura counties. She is a national consultant for the Annie E. Casey Foundation, one of the largest child advocacy programs in the country. Her curriculum is on implicit bias is being used throughout the United States and more recently to train the Sacramento Police Department. In 2009, she was awarded a grant from the California Department of Corrections to assist California public schools to reduce biases in decision-making, which lead to disparities in school suspensions and expulsions and disproportionate minority contact in juvenile justice. Dr. Cameron-Wedding's work on gender, diversity, and social justice is international in scope and includes work in Africa, Costa Rica, China, and the Middle East. As a Fulbright scholar, she conducted research in Tanzania and South Africa. In 2005 and 2007, she spoke on a national talk show in Johannesburg and Cape Town, South Africa. In 2008, she taught at the United Nations University for Peace in Costa Rica and the United Nations University International Leadership Institute Conference on the Palestinian-Israeli conflict in Amman, Jordan. In 2003, Dr. Cameron-Wedding co-edited a textbook, Ethnic America, Readings in Race, Class, and Gender. In 2004, she received the Outstanding Teacher of the Year Award for the College of Social Sciences and Interdisciplinary Studies at Sacramento State University. In 2004, also, she co-authored Institutions, Ideologies, and Individuals, Feminist Perspectives on Gender, Race, and Class. The book was revised in 2008 and includes Bias, Impact on Decision Makers, and Child Welfare. Dr. Cameron-Wedding served 2 terms as the governor's appointee to the California Commission on the Status of Women. In 2007, she was appointed by the California State Senate to the California Board of Behavioral Sciences. And Dr. Cameron-Wedding serves on the International Advisory Board of Global Majority, an organization that promotes world peace through conflict resolution, education, mediation, and advocacy. Dr. Cameron-Wedding is an approved OJJDP consultant who uses her expertise to provide training and technical assistance on issues such as, but not limited to, juvenile justice, community-based services, diversion, gender-specific issues, incarceration in prisons, mediation and conflict resolution, prevention, and juvenile justice reentry. So we're very, very lucky and fortunate to have Dr. Cameron-Wedding here today with us to talk with you about implicit bias. The reason that we brought this topic to your attention for the purposes of these PEI projects is twofold. Last year when we conducted our assessments and interviews with each of you, organizational cultural competence and discovering a way to include a cultural lens in all of our work was something that you all expressed a high interest in. And again, this summer when we conducted the interview of the program partners to determine which of those topics that we proposed as TA and training topics were of the most priority, This topic, again, of day-to-day cultural competence and incorporating a culturally competent lens into our work rose to the top as one of the most important issues that you all identified. So in our work with Dr. Cameron Wedding, we thought that we might bring this this idea of implicit bias and looking at racial impact assessment tools as an approach to addressing implicit bias in decision making. Today, the webinar is going to focus on examining the role of implicit bias in the perpetuation of systemic disparities and disproportionality for racial and ethnic populations. Given Dr. Cameron Wedding's work, this work is not focused just on racial and ethnic disparities, but we'll look at an intersection of identities and disparities that rise from not just race and ethnicity, but from gender, sexual orientation, social class, etc. We will also illustrate the components and application of a racial impact assessment tool, and we'll demonstrate the effectiveness of racial impact assessment as a tool to challenge implicit bias in the decision-making process. We'll begin by framing the issues, and Dr. Cameron Wedding will provide an overview of implicit bias, and then we'll talk to you again about the tool and what racial impact assessment is about and how you can use it. And finally, we'll make sure at the very end to talk to you about upcoming technical assistance opportunities provided by CIMH. So without further ado, I would love to introduce Dr. Rita Cameron Wedding. If you have any questions for Dr. Cameron Wedding throughout her presentation, please remember that you're always welcome to send in your questions via the webinar software, and there will also be a time for questions immediately following Dr. Cameron Wedding's portion of the presentation.
Good afternoon, everyone. It's certainly a pleasure and an honor to have this opportunity to have this most important conversation with you today. This is, for me, an invisible audience, but I know you're out there. I have been doing this work, as Autumn mentioned, throughout the country for some time now. And as it turns out, the issue of implicit bias has risen to the attention of high-level officials in the state of California as well as the rest of the country, because we've been trying to figure out how it is that all of our outcome measures in most of our systems are showing race and ethnic disparities, and even in some cases gender disparities as well. And so as I looked at the participants or the groups who had signed up for this webinar, I put together some material that I thought would be beneficial to you, that you would be able to use and that you'd be able to apply your own thinking to. But in some ways it is because of the diversity of the participants. Some of my examples may be somewhat general, but I want to encourage you, as Autumn suggested, to send in questions, and as I am answering the questions, that will allow me to be much more specific about how these issues will pertain to the work that you do and the scope of your work. So my presentation is about 30 minutes, and it is designed to examine the role of implicit bias in the perpetuation of systemic disparities and disproportionality for primarily racial and ethnic populations, but I will also talk about how it applies to gender and how it applies to social class and other issues as well. And the truth is, there's no way that you can simply just talk about race and ethnicity, because as you are all aware, we're always dealing with the issue of intersectionality, the intersectionality of race, class, gender, and even issues pertaining to gay, lesbian, bisexual issues. So I want to say that, first of all, that implicit bias, and I will describe this and define this in just a few seconds, but it's really important for us to first grapple with the idea that implicit bias is unconscious bias, often referred to as unconscious bias. And what it does, because we don't realize that we are impacted by these unconscious biases, it can really mask the influence of bias in our decision making. And so we're going to talk about how that plays out. implicit bias or hidden or unconscious biases, the whole idea arose conceptually as a way to explain the persistence of discrimination. Most people in contemporary society in the year 2013 might be under the impression that bias no longer exists, that racism no longer exists, and that all of our decisions are a reflection of the objective facts. Typically when we think of racism or when we think of biases, we think of those historic examples or the forms of bias and discrimination that are blatant and incontrovertible. When you think back, I mean, some of you may not remember personally, but certainly you can think back on your history classes, and some of you might even remember some of these issues as they occurred during the 60s. Certainly I do, but not everyone will know that. But think back in your history classes of the examples of blatant racism and forms of racism that one would consider to be irrefutable. In those examples, we would come up with things like lynching and cross-burning and the use of racial epithets. A lot of decision makers, and I'm talking about decision makers in your fields, whether it be areas such as the work in family services, or those of you who are doing work that's affiliated with juvenile justice or child welfare, those of you who work in healthcare, mental health, or even marketing and entertainment. No matter what your field, it's like all of us, we know that bias is not something that is beneficial to the work that we do. But most individuals, those of us who are teachers, social workers, judges, it doesn't matter. Most of us might be under the impression that bias no longer exists, or I should say many of us might be under that impression that bias no longer exists if we don't have the evidence of those blatant forms of discrimination like I mentioned a second ago, such as lynching and cross-burning. But what the researchers of implicit bias found out is that modern racism doesn't look like that anymore. As a matter of fact, if you can be the most well-meaning person in the world and still have implicit and unconscious biases. I certainly believe that I work very, very hard to be fair and to be thoughtful and to not let any biases get in the way. But the reality is that even those of us who do this work for a living can be impacted by unconscious biases. So in 1995, Drs. Anthony Greenwald and M.R. Banerjee posited that it was possible that our social behavior was not completely under our conscious control. They argued that much of our social behavior is driven by stereotypes that operate automatically and therefore unconsciously when we relate with other people. And I have found that in my own personal experiences. And as we go through some of this material, I want you to reflect on how some of these statements that I am making might impact you. If you can think quickly about, whether or not you have implicit biases and what those biases might look like. So when I think about my implicit biases, when I first started doing this work, I don't think that I really could recognize them off the top of my head. But then I started to think about, how I interact with my students sometimes. I found that students who came to my office who were dressed a certain particular way, particularly students who were wearing the saggy pants. Some of you know what I'm talking about, the pants that kind of hang well below their, backsides. I guess it's stylish for people of this generation, but for some of us, that dress is not a very attractive appearance. And so I found that if I am not careful, I would make assumptions about these students. And I would almost, if I am not careful, I would almost, dismiss them or think that they were not very smart, we even wonder how they ever got into college. But the reality is just because I have implicit biases about the way someone looks or the way someone dresses or the fact that they may, have tattoos or they may have different behaviors than my own, it doesn't mean that they cannot be absolutely quality students, or that they can't be the best parents, or that they can't be the best individual that they can be. It just means that I have biases. So it's very important that I am mindful of my biases so that I am not judging them on unfair or subjective criteria. So at the end of my talk, we're going to show you a bibliography, and on that bibliography is the link for the Harvard Implicit Association test. And most of the basis of my work is based on the Harvard research, as I said, that began in 1995. So an overview of implicit bias by the Equal Justice Society, based on the hard science of civil rights, how neuroscience changes the conversation. It talks about the fact that if scientists could scan our brains when we see spiders or snakes, they would see that the area of our brains that focuses on fear, threat, anxiety, and distrust is triggered, or as neuroscience brain activates more when people see pictures of African American faces than when they see pictures of Caucasian ones. Remarkably, many of the people who have this reaction state they have no conscious bias or prejudice towards others. They have no idea that these reactions are going on in their minds. So this says a couple of things to us. This says that we can have unconscious biases and not even realize that we have them, but just because we don't realize we have them, it doesn't mean that they can't affect our decision-making. The majority of the decision-making that occurs within most organizations, whether you're working in family services or education or healthcare or mental health, many of the decisions that we make, whether it's a decision as to the type of medication to provide people, the type of mental health services, the type of counseling, the types of needs that individuals may have, can be based on our own discretion. And therefore, that is why it is of such critical importance that we examine our unconscious and our implicit biases to make sure that we are providing our clients and the people that we serve with the absolute best services possible. And the only way we can do this is to explore and examine and understand our own unconscious biases. So as Autumn mentioned, I do a lot of work with judges. A lot of work with judges, social workers, probation officers, teachers, just about everyone who works, I have worked with in terms of helping them understand their implicit bias. But I find the group the most interesting. I find judges to be the most interesting group because they are, by profession, they absolutely have to be or have to believe that they are basing their decisions on the facts and that there are no biases that show up in their decision making. But what the research tells us is that even judges have implicit and unconscious biases. And many judges will say things like, I don't notice race, I just follow the rules. But the reality is very few of us, if any, individuals who were socialized in the United States can actually claim that they don't notice race. I think what happens is that if you don't notice race, it's only because you've been socialized to ignore it. Most people associate bias with racism and assume that bias requires animosity. So once again, it's very important for us to understand when we're talking about implicit bias as opposed to the explicit bias of the past, the bias that was blatant and incontrovertible, lynching, cross-burning, etc. The implicit bias doesn't require that we have any malice towards another group. We can be, as I said, the most well-meaning individual. It doesn't require that we are aware of our biases. It's not something that we set out to do. It's something that happens. And the reality is that even when we're unaware of our biases, or unaware that biases are existing, it doesn't mean that the racialization process doesn't occur. It means that it can occur even more easily because we're not aware of it, and therefore we can't reflect on it and we can't intervene against it. One judge that I worked at, he said to his entire court staff, He said, if I find someone is discriminating, they better find another job. Now, I thought this was an interesting statement, and the judge was absolutely committed to this notion that he would fire anyone he found discriminating. But the reality is he better be prepared to have a totally empty staff, because I don't think, as I said before, that there's any one of us who can claim that we don't have some biases. Biases have an impact on everything we do. Implicit bias can affect our perceptions. They can affect our priority setting, our policy development, resource allocation, outreach, any forms of service delivery, customer service, and decision-making at all levels of the organization. I often am amazed at how sometimes when I am African American, and sometimes when I go into stores and I ask questions that I think are very intelligent questions, that people respond to me as though it is an inconvenience to them, that I shouldn't be asking the question, that it's a problem for me to ask the question. And I think for me, I'm so used to this response that I don't notice it. But often when I am in these stores or in these situations with my Caucasian friends, they're actually quite astonished at how people react to the questions that I ask. And they often say to me that they ask those questions all the time, and they usually get the answers provided to them quite easily. So biases can distort how we see people and how we react to people. Implicit bias also affects how we behave, how we interpret the facts, how we hear the facts, and who gets the benefit of the doubt. And in just a bit, I'm going to provide you with a lot of examples of those things. So there are two factors that I want to explore that I believe allow implicit bias to occur without notice. So in the early part of my work, a lot of the individuals that I worked with in child welfare, they wanted me to come up with some explanation as to how bias can persist in contemporary and modern society. And I identified two categories or two areas that allow modern bias or implicit bias to persist without interruption. And those two things are stereotypes and color blindness. And stereotypes and color blindness work in tandem. Stereotypes reiterate the themes and messages about groups, while color blindness says that we should not notice race. And it shuts down our critical thinking about race, so we don't notice it consciously. But while we are not noticing race consciously, we are still bombarded by the stereotypes. Stereotypes are ubiquitous in our society. And stereotypes are found in every single institution that we deal with, particularly in the media, and we'll talk more about.
Nope. What happened? Okay. Send a chat. Okay. Shoot. I don't know what happened.
Hello, everybody. We lost our telephone connection. But I think that we've gotten reconnected now, so we apologize for the disruption in the webinar. We just want to get a quick check to make sure that folks can hear us. So please, please let us know. If we get a couple of responses, okay, great. It looks like people are able to hear us now. So apologize for that disruption. We don't know what happened, some technical difficulties, but we'll go ahead and continue.
So colorblindness and stereotypes, as I said, work in tandem. And the thing about colorblindness is that it suppresses the public discourse on race. It essentially tells us that we should notice race, we shouldn't think about race because we're all on a level playing field. And it's interesting when I make that statement in an audience, in a live audience, where people are actually present, everyone can fill in the blank when I say we're all on a, and then the group will answer level playing field. And that's because most of us are getting these same messages regardless of whether we live in California or West Virginia. Colorblindness also says this. It says, but whoever mentions race first is the racist in the room. So I think what happens as a result of that, the fear of being accused of being a racist suppresses the public discourse on race. Judge Harry Blackman says, in order to get beyond racism, we must first take account of race. And so implicit bias gives us an opportunity to make implicit or unconscious bias explicit. An example of stereotypes, I want to read this quote to you, and this is an example of how stereotypes, how ubiquitous stereotypes are, and that we are forever brainwashed by these images. At this point, we're going to show a video that also gives us an opportunity to look at the impact of stereotyping. It's called Psychology of Stereotypes.
Categorize people automatically, unconsciously, immediately based on a person's race and based on the person's sex. It begins in childhood. We brought together 3 groups. Who do you like better, this man or this man?
The Chinese guy.
Again and again, when we were kids, preferred the Asian man.
He looks meaner and he looks nicer. He has a smile on.
But both men are smiling. And what did the kid think about the personalities of the men? We asked, you don't know this person, but what do you think he's like?
I think he's weird.
Why is he weird?
He doesn't look like a very nice person. No. He looks like a scary dude.
He's on the phone. What's he talking about?
Maybe a raspberry?
What's he like?
He looks like a regular teenager to me.
We then showed them pictures of a black man and a white man. What were some comments about the black man?
He looks mean. That man was thorny. He looks like mean. He looks like he's a basketball player.
So, tell me about this guy. Seems like a nice person?
I think he's nice. I think he's nice, except he might be mad about something.
He was probably picking up on something. This is Oklahoma City bomber Timothy McVeigh. Admittedly, the pictures are a little different. But when we asked which man is a criminal, most kids pointed to the black man. And when we asked which was a teacher, they said,
That one! The guy in the green shirt.
which is ironic, because he's a Harvard professor. Of course, we adults claim not to have these biases. But
So I think we can see from that clip, that brief clip on stereotypes, how prolific they are and how I like to use the word ubiquitous because they're all over the place. And the kinds of stereotypes that are reflected, even though these are children and we know this is not a scientific study, but I think it does still make the point, gives us an opportunity to really examine the impact of stereotypes and stigmas on mental illness, because even even people who are particularly people of color or women or poor people have probably a different experience with stigmas because they oftentimes don't have the resources they need to be able to get the services that would help them manage in society better. So the other piece that I want to show, a very quick clip, is it gives us an opportunity to examine the issue of color blindness and how color blindness suppresses the public discourse on race. and this is called A Girl Like Me.
In Brown versus Board of Education, the famous case that desegregated schools in the 1950s, Dr. Kenneth Clark conducted a doll test with black children. He asked them to choose between a black doll and a white doll. I decided to reconduct this test as Dr. Clark did to see how we've progressed since then. Can you show me the... That one. I like to play with this. And can you show me the doll that is the nice doll? And why is that the nice doll? He's white. And can you show me the doll that looks bad? And can you give, and why does that look bad? Because it's black. And why do you think that's a nice doll? Because she is white. And can you give me the doll that looks like you? 15 out of the 21 children preferred the white doll.
So while most of us would like to maintain that we are colorblind and we don't notice race, I think that very short but powerful clip gives us an opportunity to really rethink and reflect on our own potential biases. And what I'd like you to do at this point is to just think for a second before I go on to the next part about the potential racial impacts that you might identify in the scope of your work. And I want you to think about them within the context of, looking at this now through a racial and ethnic lens. What might you see differently than you saw before the webinar in terms of how the implicit biases might affect your own perception of the work that you do and the clients that you work with and the services that you provide? So I just want you to just think about that for a second as we proceed. The last part of my presentation is, gives you an opportunity to really think more precisely about your organizational needs. And as I said at the very beginning, I recognize that the audience are members of a very diverse types of work, whether it's media, families, education, juvenile justice. And some of you are certainly very much interested in mental health and healthcare issues. So I don't have a lot of time left, so I'm going to abbreviate some of my comments, but I'm going to give you some information that will help you make the connection between the work that you do within the scope of your agency and decision making. So I want you to think, the example that I'm going to use is education and juvenile justice. I think this is something that will impact everyone in the room, because while the broader focus might be education or juvenile justice, I know many of you work with children, you work with families, and these children and families have mental health issues, and they have health issues, and decisions have to be made around these issues. But I'm going to start with education, because this is a system that all of us have to engage with. Education is a system that has always been identified as being one of the most neutral systems that we work with. We think of teachers fondly, and they do the lion's share of the work of our society. We know that. But the reality is that teachers, like judges, like counselors and probation officers or social workers, all of us are human beings, and all of us can be impacted by biases. And so biases will show up in very different ways. It can show up in terms of our attitudes that we have, the values that we have. It's like as a teacher or in the scope of your work, if you have personal values that suggest that the ideal family is a family where there's two parents and the children are living in a home that is owned by the parents. I mean, there's still a lot of people who believe, when I'm working with social workers, they believe that children should not grow up in apartments. So if your personal values has to do with the fact that that the parents should be married and the children should be in a home that is owned and that the income should come from earnings, then those are attitudes or might reflect values that could impact the decisions that you make. Or, for example, our implicit bias can affect the way that we apply policies and procedures, and we're going to talk about that in just a second. Or, for example, in the case, and the example that I'm going to use using education and juvenile justice, I want you to think for a second about the way that language can impact can have a racial impact. When you are, whether you're actually working in schools or you're working with individuals in schools, it's important for you to understand that there are words that you choose or words that you read in affidavits or reports that can impact how you perceive the people you work with. And a lot of affidavits and reports, according to judges and people who are working in child welfare, for example, they have noticed or identified the fact that there's a difference in the way that we use language when we're working with white mothers compared to when we're working with black mothers. And according to judges, they say that in affidavits, the white mothers, when they are faced with losing their children into the child welfare system, the white mothers are often described as being upset, where in the same identical situation, the black mothers are often described as being angry. Another example of the impact of language has to do with white mothers when they're talking about whether or not the white mothers have any drug involvement. It will simply say no drug use. But when a black mother is involved, it will often say something to the effect of mother alleges no drug use. So I just wanted to give you that to help you understand that implicit bias is not necessarily a big thing. It can be a small thing in terms of how we use language. So one of the things that's happened recently that's had a huge impact on our society is the role of education and the use of its policies. All of you are dealing with, or your organizations all have policies that it has to abide by. And so we all have to be very mindful of the impact of these policies. In education, the policies that were designed for the very purpose of helping children, it has turned out that these very policies have had a very dire impact on children. In many jurisdictions across the country, because of zero tolerance policies, for example, fighting, which has been known to school children all over the world since the beginning of time, has now become a battery. And I'm not talking about, fighting in which somebody is actually named or something. It could be just a schoolyard fight. Oftentimes, these events are now being identified and in many ways criminalized and identified as disorderly conduct. The events have had such a huge impact on children that we have found that there's a new terminology that's used. It's called the school to prison pipeline, because we're seeing that so many kids are being suspended from school, and if they don't go to school, if they're not getting educated, we're finding a greater number of these kids who are being filtered into the juvenile justice system. So the laws will impact this. So you have policies, you have laws, and all of these things will have an impact, a huge impact on the outcome. So it's really very important for us to understand how this works. I want to show a picture. If Autumn can pull up this picture, and it will just take me a second to, it's the one in Florida. I just want to show this picture. Hopefully all of you can get a clear picture of this. This is an image of a school child who's 5 years old. And obviously this child is being surrounded by law enforcement. And the law enforcement are, I would like to ask you, I want you to think about what you think is happening here, but in the interest of time I will tell you the 3 police officers are actually arresting the 5-year-old girl. This 5-year-old girl is an example of the impact of policies and decision makers. Educators as decision makers have implicit bias that has led them to think that this child is of such a grave risk that she must be arrested. What you see in this image is going to drive your next decision. If you see that there's something going on in your organization, I want you to ask yourself the extent to which your implicit biases might be influencing your perception of risk in this case. So I'm going to, should we open for questions now?
Yes.
Okay, great.
So if you have questions, as we've done in the past with these webinars, please raise your hand using the webinar software to raise your hand, and that will we will unmute you so that you can ask a question of Dr. Rita Cameron-Wedding about her presentation on implicit bias. So we'd love to have some audience participation and some interactions here. So please raise your hand if you'd like to ask a question of Dr. Cameron-Wedding. Or anybody have any comments or thinking back about the question that Dr. Cameron-Wedding asked us to consider just a few minutes ago about how have you seen implicit bias kind of play out in the context of the work that you're doing with the statewide prevention and early intervention projects, maybe not in the development of your projects, but how has implicit bias played a role in shaping your response to that bias and stereotyping that exists in society, not just of racial and ethnic populations, but for people with mental health conditions as well? I know that some of you folks working with the media have probably had some of this play out. And let's see, we do have a question. How have you seen implicit bias play out in regards to individuals with disabilities, different types of disabilities?
That's a really good question. One of the things that we find particularly in schools is that there are a lot of children who are misdiagnosed. Oftentimes, race, for example, social class can influence the kinds of diagnoses that children get. One of the highest rates of kids who experience school suspension are kids who are children with disabilities. And so that's a huge issue right now in education. And so, families need a lot of support around that because oftentimes, the teachers and school decision makers are assuming that these behaviors are just simply associated with disruptive behavior, and as opposed to it being a mental health concern. And oftentimes, like I said before, these children are simply misdiagnosed, so it's a huge issue.
Okay. The next question that we have is, how are policymakers, judges, school administrators, et cetera, responding to your presentation? Are you seeing any changes?
Absolutely. When I started this work probably 7 years ago, and sometimes I laugh about the fact that when I started this work, it was so hard to have these conversations. People were very, circumspect. They could not understand implicit bias. They wanted to believe that we were living in a society that was free of any bias because, like I said before, they weren't seeing the blatant and incontrovertible examples of discrimination, so they felt like we're all good. The very first time I showed the image of the black girl in handcuffs, it was to a room full of social workers, and people were a bit outraged, but I think they were outraged at me. They were outraged at me because they couldn't understand, they felt like I wasn't telling the whole story. Subsequently, I met the judge on that case, and she confirmed that that child was simply arrested for having a tantrum. That was that child's offense, and I didn't mention that earlier. So while years ago, people were having a very difficult time grappling with the idea, like I said before, across the country, we are getting better and better reception. People are really embracing this idea of implicit bias because I think that when people really think carefully and critically about their own thought process, they can see how these biases play out. So now, and just last week, Autumn and I did some work on a project that was called Keeping Kids in School and Out of Court, and what we found, and we were doing this work actually too on the racial impact statement and assessment tool, and what we find is that people are more and more interested in learning how to do this and being involved in this work.
So it looks like we have somebody has raised their hand. Some brave soul would like to speak with us. So Rob, I'm unmuting you. Go ahead and ask your question.
Well, you know, I'd like to get the opinion of people who go for mental health services from racially diverse communities that get different treatment than a white person might get.
Yeah. Yeah, so you want to know how that treatment is different?
Well, you know, I have observed it myself, but I just wonder how, if there are any studies or anything that has gone on to show that people are treated differently.
Yeah, absolutely. Absolutely. There are a lot of studies out there, and a lot of the studies have to do with implicit bias. So it's mental health as well as health care. I'm going to talk about health care, and then I'll go back to mental health. In health care, one of the things that we have found in terms of implicit bias is that there's an assumption in the by healthcare professionals that African Americans and Latinos are not trustworthy when it comes to pain medications. And so African Americans and Latino people tend to be underprescribed when it comes to health medications because the assumption is that they might be more inclined to sell their prescriptions than white people would be. So that's one example. Another example in healthcare in terms of differences in treatment has to do with the fact that white children tend to be 8 times more likely to experience to be misdiagnosed for abusive head trauma, 8 times more likely to be misdiagnosed for abusive head trauma, and that is because the perception is that white families are good families, solid families, and that there would be no abuse or neglect in that family. So you see biases that go, the full range of the health delivery systems in terms of just general health care as well as mental health. And as I said earlier, African American children and Latino children, children of color in general, have a different experience when they're trying to seek out mental health services. Kids who are being identified as children with disabilities are often identified as having disabilities relating to behavioral disorders, and they're less likely to be diagnosed as having disabilities that are more systemic or have some sort of other cause associated with them. And so as a result of that, they get this different treatment. Kids of color are more likely to be punished for the same behaviors that you will find in kids who are, you know, diagnosed as ADHD or Asperger's. They're more likely to get the kind of treatment and the kind of support. But kids of color, it's that stigma that we're talking about that stigmatizes them as being, or that stigmatizes them and problematizes them, and results in them getting different treatment and different services and fewer services.
There's also been some more recent studies looking at in the opposite from the health field and prescribing of pain medication. There's been some recent studies looking at the over-medication of youth of color in mental health.
Absolutely.
So for mental health conditions, behavioral conditions, over-medicating children rather than under-medicating them. So thank you for your question, Rob. We hope that we answered your question. If anybody else would like to address us directly, that'd be great. We do have some more write-in questions here. So the next question we have is, how have you seen implicit bias, or how have you seen implicit bias with people toward their own race? What part does the media reinforce this bias? How do you get the media to understand their role in the development of bias?
Right. Again, very excellent questions. There is absolutely the same potential for people of color to show and experience bias towards people of their own social group. So we know that to be true, and that's the reason, implicit bias, people of color are exposed to the same stereotyping, the same media images, the same media representations that stigmatize groups of people. We're exposed to the same information, and we can have the same reaction. The other thing, too, that I haven't talked about is social class. Social class is one of those issues that really must have an overlay on this conversation, because, what we know to be true is that a lot of the stereotypes that we see in the media are stereotyping poor people of color. I mean, obviously, wealthy people get stereotyped too, but the groups that we tend to be the most afraid of are also people who are poor people.
Okay, thank you. Looks like we have another question here. Just a moment, because I lost it. Okay. Are there strategies you can suggest for organizations to recognize implicit bias and work to reduce its impact?
Yes, that takes us right to our next portion of the webinar, and Autumn is going to talk about the role of the racial impact assessment as a tool to help reduce the impact of
and many other folks, emergency preparedness and social services, 14 total state agencies combined. We began to work together on the development of a racial impact assessment tool. And Dr. Cameron Wedding has served as a consultant to the work group in helping us to develop this tool. And we thought that this work would be good to share with all of you, because it would do just what Kayla asked us just a moment ago, to provide a tool to address implicit bias as we roll out these PEI projects statewide. So what are racial impact assessments? Racial impact assessments are tools that provide a mechanism to examine the impact of unintended consequences for racial, ethnic, and cultural populations that may arise from proposed actions or decision-making processes. So Dr. Cameron Wedding gave us some examples of what some of those unintended consequences could be. There are a lot of other examples as well. Over-medicating children is one of the unintended consequences that can come from implicit bias in the mental health field. Recently, I was listening to NPR on a Saturday morning as I was driving about doing errands and things, and there was a story from the city of San Francisco where their city council is considering passing a new ordinance that closes the parks overnight. Apparently, San Francisco is the only city in the country that does not have such an ordinance to close their parks overnight. Well, the story that I was listening to as in the midst of preparing for this webinar and our other presentations that we've done on this topic recently was talking about the unintended consequences of that action, of closing the parks. The policymakers and the city council folks wanted to close the parks because they wanted to mitigate the impact of graffiti and violence and things that are happening in the park, drug offenses. But this whole story was talking about the consequences of that action would be that it would further criminalize homelessness in San Francisco, because many people use the parks as a place to sleep. And so thinking about some of the ways that that unintended consequences play out in the work that we do in the mental health field, we really thought that bringing this racial impact assessment tool to our field could be useful in kind of thinking through some of the potential unintended consequences, or thinking through how to address some of the disparities that we see in our public mental health system. Racial impact assessments are similarly constructed to those of fiscal or environmental impact statements. I don't know how much you all know about kind of the history of environmental impact statements, but these environmental impact statements kind of began out of a movement in the 1960s to examine the impact of construction and building projects and drilling and other sorts of projects to ensure that they have a minimal impact on the environment. So there's legislation in the United States. We're one of the most comprehensive legislative actions on environmental impact statement in the world, to make sure that we're not having our construction projects and our drilling and fracking and all of the things that we do to develop our cities and our territories, that they don't have an adverse environmental impact, or that if there is an adverse environmental impact, we're aware of it and we're able to mitigate the consequences that stem from those actions. The racial impact statement would provide the same sort of tool. It would allow us to examine the full spectrum of factors that could come into play when a new policy or a new project is being implemented, and it's something that you can assess throughout any phase of the decision-making process. So many of you are in the later stages of developing some of your projects and your materials, but that doesn't mean that there aren't still advantages to assessing the racial impact or for racial and ethnic communities, for socioeconomic populations, for LGBT populations, and looking at the impact of these programs and the potential consequences that could arise from them. So the racial impact assessments have been used to enable policy and decision makers to anticipate and address racial and ethnic disparities arising from implicit bias and systemic racism and discrimination. To extend that to looking at the implicit bias and systemic discrimination inherent in mental illness, you can further explore some of the consequences unintended consequences of our proposed actions. Some of the ways that the racial impact statement has been used in other places. It was actually originated in the United Kingdom over a decade ago as a mechanism for public authorities to eliminate unlawful racial discrimination, to promote equality of opportunity between people of different racial groups, and to promote good relations between people of different groups. And it's used primarily as a legislative tool. That's how it's also been used here in the United States to date. In Iowa and Connecticut, there's been legislation passed that requires a racial impact assessment report to be completed before any new sentencing laws can be passed by the legislature regarding the sentencing in the criminal justice system. It's also been used in Oregon. Recent legislation has been passed in Oregon that a racial impact statement report must be produced by a legislative analyst to show how a proposed law could have consequences affecting racial and ethnic populations before the legislator can vote on the action. In Oregon, the law has also been applied to the child welfare system, so it's slowly gaining momentum and growing in its applicability across different systems. Because the other thing that we know, just like what Dr. Rita Cameron-Whiting said earlier about we all have multiple identities, and the intersections of those identities impact our experiences. We all have experiences, or many of us have experiences in multiple systems. So especially we're talking about people who enter the mental health system. Certainly there's a lot of evidence that people in the prison system or in child welfare, for instance, have mental health conditions that are untreated as a result of kind of where they're getting services. They're getting services from the justice system rather than receiving community-based mental health services. And that's part of the issues of stigma and discrimination, and trying to make sure that we make mental health services more accessible for people, and more likely that people will seek services before they get into a place where it's serious consequence like criminal justice involvement, but that we prevent mental illness from getting to that state. Again, the racial impact statement legislation has been passed in Washington and Illinois also. In Washington, particularly in King County, Washington, they've created an equity impact tool, which they use to process in the development of all of their policies and proposed projects. So the tool identifies and evaluates the potential impact of policies and programs on equality. So while here we're talking about racial impact assessments, a more appropriate term might be looking at equity impact assessments or equity impact review tools. And we'll make sure that you have the link to that information. But in Washington, they have really taken this to a much further level and not applying it to a particular system, but in the development of all county policies, there's a series of questions that they are required to address before they can implement any new policies or projects. And that's kind of where we're going with the work that we're doing here in California with the work group to eliminate disparities and the state interagency team and what we're introducing to you here today as well. Really, all of the tools that we looked at for racial impact assessment boil down to two critical questions. Are there potential unintended consequences for racial and ethnic populations? And if there are potential unintended consequences, what is the appropriate alternative course of action for that project or that proposed action? So although there are several questions in the tool that we've developed, really it boils down to identifying those unintended consequences that stem from the implicit bias, the stereotypes, the systemic discrimination and racism that Dr. Cameron Wedding discussed earlier. We also think that the racial impact assessment can be applied across all organizational domains. We looked at, in the development of the initial tool, how this could be used as a tool in public policy, so legislative action, in policy actions, in administrative actions. So each of our agencies has an administration section, a contract section, staff development section. We also have program development. That's the work that most of you are doing. It applies to our stakeholder involvement and how we have advisory committees or a community program planning process. Many of you are really great about having advisory committees and involving them in the development of your projects. But as you remember, we started this project last year with looking at the organizational capacity for each of you, and so wanted to kind of bring it back to that level and looking at throughout your entire organization, there is applicability of this tool in moving forward. It also certainly directly relates to the development of your PEI deliverables and projects. So also looking at research and evaluation, compliance and monitoring, and public relations. So looking directly at marketing and social media strategies. So what we're going to do really quickly is take a look at the tool that we have developed just to show you the components of it and how it would work. And then we will open it up for questions if you have any questions about the tool. So basically, the first part of the tool is fairly simple. It just asks for you to describe the proposed action or project, describe the target population with some level of specificity about your project. So what is the target population that you're trying to reach? And you should keep that in mind as you're answering the rest of the questions that are in the tool. So you may find that as you're developing a project for a specific target population that there could be an adverse unintended consequence with another population, and you want to be aware of that as well. But you want to know what it is that you're trying to accomplish, and so this just gives you a kind of way to think that through a little bit as you start to go through the tool. And then finally, what are the unintended, or what are the intended outcomes of the proposed action? And later it'll ask you to identify some of the unintended outcomes. So the next part of the tool goes back to some of those organizational domains that we talked about. So this also stems back to some of the questions that we asked in our initial assessment of the organizational assessment and the interviews that we conducted with each of you last year. So looking at how you are measuring your effectiveness with underserved communities or the target populations, looking at linguistic access and diversity, how does your organization deal with issues of linguistic diversity, how does your organization deal with staff diversity, how diverse is your staff at all levels, what strategies do you have for enhancing diversity of your staff. Also looking at your community engagement strategies. So a lot of the work that we've been doing in this technical assistance series has been focused on community engagement. We had the presentation at the statewide coordination work group, and then another presentation in October on language access, and then the community engagement seminars, which are coming up. So we really want to make sure that you're thinking through some of the relevant issues with community engagement. So what is your organization's relationship to the community relative to the proposed action or project? Have you engaged the community in the development of the project and the implementation, design, evaluation of the project? Do you have formal relationships with communities based on community-based organizations? What's the role of consumers and family members in your project? What community events does your organization participate in to promote the project, et cetera? The next part of the tool asks a series of questions related to community needs and assets. Does the proposed project reflect the specific needs and assets of the diverse community served? So really asks you to think through how the project is tailored to meet the needs of the community. So some of you are engaged in cultural adaptations of existing projects or products. And so this would help you to think through some of the factors related to those adaptations to find out how the project is tailored to the cultural needs of the community. It also asks you to look at, or asks you how you look at strengthening natural community supports and assets. And so really these series of questions are focused on making sure that you think through kind of all of those organizational domains and factors that come into play when developing a new project, product, or service. Messaging and social marketing is another area where we think it applies to most or all of your projects. Is the messaging and social marketing strategy relevant, culturally relevant? Do you have websites that reflect the target population's values, beliefs, et cetera? Is the language appropriate? Are you posting the right information on your websites to get people to your website? Are you generating the traffic that you want to see from the target population? And if not, what can you do to enhance the content of your websites to make sure that the message is getting out? And then finally, this part of the tool looks at the organizational infrastructure. So is the project, is there an advisory committee that's charged with enhancing the cultural competence of the project? Is there collaboration with cultural leaders, cultural brokers, cultural organizations, and faith-based organizations? Do you have financial support for the proposed project? Enough financial support, I guess, is probably something you might want to think about it in that way. So is there a budgetary alignment? I know this question came up when we were having the discussion about language access. So making sure that you appropriately allocate for translation of materials and interpreter services. That's part of the financial support. You need to make sure that your budget reflects the needs of the community and that you have the funds necessary. So all of these are just supposed to help you think through some of the key considerations and some of the elements that could lead to unintended consequences. And then you get to the next part of the tool, which is really about determining whether or not there is a disparate impact for racial and ethnic populations. These questions that we've put into the tool here are really based on the tools that we looked at from other states. The King County tool from the Equity Impact Assessment tool that they use to develop all of their new projects and programs uses many of these questions to help the program developers really think about the unintended consequences that could arise from the project, if there's a disparate racial impact for a particular population, or how you know that there could be a disparate impact, if the impacts that occur from the action could contribute to systemic disparities and disproportionality, what specific impacts can be identified, can they be mitigated by a change in the course of action, or if there's a positive impact, can it be enhanced and expanded to other population groups? Then this last part is really just the certification of your findings. One thing that we found in kind of piloting this tool out in other audiences is that some people like the idea of a certification and some people don't, but this is just a way for you to kind of summarize your finding. Either there is a unique positive impact for culturally, linguistically, racially, and ethnically diverse populations, or there's a unique negative impact, or it's not expected to have any impact at all. And this would be a way that you could communicate with with your agency leadership or your contract manager or others who kind of are decision makers around the work that you're doing, where you say, we've thought through some of these issues around the potential consequences for racial and ethnic populations, and here's our findings. And then finally, the last part of the tool is a recommendation. So based on the findings of the racial impact assessment, you would recommend no change in the policy or the project. You would recommend minor changes or recommend significant changes. And so that, again, would be a way for you to communicate. If you're staffed to a project, one of these PEI projects, but you're not the lead of the project, you could use this to make a recommendation to the lead on the project or to your contract manager to kind of change the project because of this assessment you have found that there would be some negative unintended consequences. So basically that is the tool in a nutshell, and hopefully that answers your question about what are some tools that you can use to address some of these adverse impacts. And we'll have some time for some more questions. I am putting up on the slide here key resources. So these are some of the resources. Earlier in the presentation, there were some resources that Dr. Cameron Wedding gave us related to implicit bias specifically. These are some resources that are related to the development of the racial impact assessment more specifically. And so we wanted to make sure that you had the ability to access these tools. We'll also make the tool that we've created available for you, as well as these presentation materials and the recording of the webinar on the CalMesa website following the webinar. So with that, I'll pause for a moment to see if there are any questions. Okay, so one of the questions is, can you provide an example of any unintended consequences you may have identified in a program, and then how you modify the program in response to your realization? Dr. Cameron Wedding, you want to talk about your example in Shelby County, the work that you did down there?
Yes. Actually, the beginning of this year, we were asked by the United States Department of Justice to do some work with the Shelby County Juvenile Court. And what they had found through their research and through their actual investigations is that Shelby County Juvenile Court was responsible for the violation of human and civil rights of African American kids. And so it was unintended consequences in as much as, you know, the individuals really felt like whether you're talking about law enforcement or all of the organizations that were contributing to this problem, it would be schools, it would be law enforcement, it would be juvenile justice, and also the decisions of the court. And it was the impact of implicit bias that was causing them to think, and this is their exact words, that African American kids were the worst of the worst. So their implicit biases led them to believe that these kids were the worst of the worst. And even though in that particular jurisdiction they had 50-50 ratio, 50% of the youth in that jurisdiction were African American and 50% were white, the only kids who were in the juvenile court or juvenile justice facilities were African American. So it was clearly implicit bias. The other thing I want to say about that that's really interesting is that the majority of the workers of that community happened to be African American. And so that gets back to the question that was asked earlier, and that is whether or not people of the same race can have bias against people who look like themselves, and of course the answer is yes.
I think that the example I gave about the city of San Francisco and the park closures is also another example of how kind of an initiative can have unintended consequences and how modifying that initiative, so not closing the parks would be one way to not criminalize, or changing kind of the ordinances around or modifying the language of the legislation to ensure that people who are, you know, using the park to sleep are not engaged in criminal activity, or there are other ways to kind of address the inherent biases that come into play related to that particular project. But that was also an example of how unintended consequences can be identified in a program and can be modified in response. I think also looking at the development of websites and kind of the images that you choose. I know that in our preparations for the webinar we were having a discussion about kind of that issue about developing websites. And I know in some of the work that I've done here with CIMH, there's been a lot of, like in producing reports or pamphlets, there's discussion about which images are appropriate to choose and which images are not appropriate or maybe less appropriate to choose, and kind of how bias plays out in making those decisions can really change the look and feel of a product based on kind of the viewer's response to a particular image, and if they think that image is reflective of the population or not. I know you had kind of a similar experience.
And I want to add to what Autumn just said, and it's important to understand that a lot of those decisions about what looks best on a website can be driven by at least influenced by our personal values. And so, you know, what we believe is the most attractive image can have an overlay of implicit bias. And so we just have to be, again, mindful of that at every stage of decision making in any organization, implicit bias can influence the outcome.
Yes, okay, we have another question here. How do you create awareness of these implicit biases, and what toolkits can we create to allow them to leave it at the door mentally so that we can have a more peer-to-peer approach without bias?
Well, I don't think there's as I say, I don't think there's a magic bullet for the work of implicit bias. I did on the one bibliography that we have available to you, I do have the Harvard Implicit Association test, the website, the link for that website, so that you can go into that website and you can, you know, test your own implicit biases. But I think that, you know, certainly the two that Autumn has presented to you today is a way to help you examine, you know, go throughout every step of the way to examine the potential of racial impact. But I think that we are just going to have to do the hard work of exploring the potential of individual and institutional biases.
And I think too what you were saying earlier, Dr. Cameron Wedding, about making race explicit.
Yeah.
And I think the Blackman quote about
right.
About we must take account of race.
That's right.
I think that is critical in kind of leaving it at the door. You don't leave it at the door. You have to bring it into the room, but you have to make it explicit and have that conversation about race and about ethnicity, and kind of put all your cards on the table in order to really truly address implicit bias in decision making. So even within your internal teams in your organization, kind of putting it out there and being explicit about the impacts on racial and ethnic populations or on yourselves, or kind of just bringing that conversation and dynamic into your discussions and your project development is one of the ways that you address it.
Yes.
Okay, and then we have one more question here. Would it be possible for us to be sent a PowerPoint and contact info for the presenters? Absolutely. All of the PowerPoints from all of our webinars are on the Cal Mesa website. So we'll make sure that you have access to those. We'll also be posting the recordings of the webinar, so if you want to share this particular session with somebody from your team who wasn't able to join us today, they can view the webinar from the link on the Cal Mesa website. I don't believe that it will be up today, the link. The PowerPoint is up there today, but the link to the webinar should be up there by tomorrow. We've been having some difficulty converting the videos and posting them, but I think we've figured that out, and we told Michelle Yang at Cal Mesa that we would send her all of the links to the recordings of the webinars so that they can also be posted. So thank you again for joining us. Don't leave just yet. We did want to give you just a little bit more information about the upcoming community engagement seminars. I know some emails have gotten sent out about these about the seminars. We have consolidated down to 2 dates. We originally were going to offer 3 dates, but we had 6 program partners sign up to present their storyboard presentations, which we're really pleased about. But we didn't want to spread it out over 3 dates, so we're going to have to start off with 2. The community engagement seminars are really an opportunity for you to share some of the challenges that you've had with community engagement. Presentations are not a requirement of participation in the seminars. The seminars are for all program partners. We would like for you, even if you did not sign up already, to still participate in the seminars and contribute to the discussion and dialogue. We wanted to have the storyboard presentations to give program partners the opportunity to kind of explore specific challenges that they were having around community engagement and to seek advice from a panel of experts on resolving some of those challenges. It also gives program partners the opportunity to share some of the successes that you've had. So we do have 6 program partners signed up to present. If you'd like to hear their presentations, we welcome you all to join us and participate. We'll be sending out sometime next week before we leave for the holiday break. We'll be sending out more detailed information about kind of the content and scope of these seminars and what the program partners are going to be sharing. So maybe, for instance, if somebody is presenting on some of their challenges related to reaching the LGBT population and you're experiencing some similar challenges, you might want to join in that conversation, kind of hear some of the dialogue around that storyboard presentation and the work that the program partners are doing, because it's really important to us, and I think to all of you as well, that we make the connections between the work that you're all doing and you can figure out how to leverage each other's work and build on that. And so these community engagement seminars will give you an opportunity to hear from the program partners who are brave enough to volunteer to present, and we'll give them an opportunity to hear from a panel of experts, but you'll also be able to gain valuable information from that experience. So I just want to say a little bit about that, but thank you so much to those of you that signed up, and thank you so much to all of you who participated in the webinar today. We found it to be really informative in kind of developing the webinar and the tool, and we hope that you found it to be valuable as well. We'll make the tool available on the Cal Mesa website as well. One last thing I wanted to say about the racial impact assessment tool is that it is not meant to be a tool that cannot be adapted. So if you look at it and you think, this doesn't really work for me, it's too long, there's too many questions, or this doesn't apply to the work that I'm doing, it's perfectly acceptable to adapt it, and we are willing to help you do that. The last thing I wanted to remind you about is that we still have plenty of hours available for technical assistance. So if you would like individualized TA on any of the webinar topics that we've presented, or specifically on the racial impact assessment, you can complete a TA request form and submit that to us, and we can help you to kind of adapt and create a tool that works for your agency and the work that you're doing on these PEI projects. So thank you again. Thank you very much to Dr. Rita Cameron-Wedding. We appreciate your time and being here and sharing your extensive knowledge and expertise. Thank you to Christy, and thank you to everybody who will complete the evaluation survey as you exit the webinar. We really appreciate the couple of minutes you take to fill out that survey. So thank you so much, everybody. We hope that you had a good time with us this afternoon, and we'll talk with you soon. Happy holidays.
The organizer has ended.